Hi, I'm Dr. Brian Hendriks. I could not help but make a quick video. This ad is so misleading. I found it on Facebook. It's talking about mini dental implants. I just want to call out some things. First of all, this is how it describes mini dental implants. It describes them that you could use it for overdentures, which is true, but implant supported dentures, which is not true. You cannot use a fixed implant supported device with mini implants. Secondly, why mini dental implants? They're less invasive, less complex. That's not true. Ideal for various jawbone density. Not true. Quick recovery, minimal downtime. This is semi-true. The surgery might be a little simpler, but the recovery as far as when you get your teeth back and be able to use them, that's very complex. That takes time, and you have to heal with a regular denture. Cost effective with incredible outcomes. Maybe cost effective. Incredible outcomes, now that's up for debate. And then it says these are the things that shine. Enhanced jawbone strength. Not really. It's going to help it so that your teeth are retained when you bite and chew, but it's not going to give you extra strength. Matter of fact, if you had regular teeth, it's going to be at least 50% less biting force. No mess adhesives. This is true, but for many people, they have to actually still wear adhesive even with snap-in dentures. Secure fit, strong bite force. And again, if you're comparing to when you had teeth to now when you had a snap-in denture, it's going to be much less. It'll be better than a denture, but much less than when you had your natural teeth. So here's the thing. I'm okay with doing snap-in dentures. What I'm not okay is putting ads out there. There's so many things wrong with this. It's alluding to this as being a snap-in denture. A mini implant is basically an implant where, again, this portion would be a screw. This is the portion you see in here and here. It's the screw portion. A mini dental implant is very, very thin, and it's all connected by one piece. Meaning that you can't trade out that part there. You can't unscrew this portion from this portion. That's a mini single piece implant. And so that's what you're seeing is one piece. And so there's only one use for a mini implant, and that is to have it used with a snap-in denture. What's ridiculous about this is that they're showing a bridge here that is a bridge, we call them FP1s, meaning that it's only replacing teeth. There's no gums, there's no support around the gums and the soft tissue. What a snap-in denture does is it is supported by the tissue, and it's retained by the implants, meaning that the implants, that top portion, that ball portion, that portion is mainly making it so that denture stays in. It's not making it so that you have this biting force, because every time you bite down, it's going to push up into this little O-ring that's inside here, and it squeezes in there. And so essentially there's still going to be movement as you bite up and down. You're still going to experience food getting up into there. But at the end of the day, this marketing is so horrible. It's just so horrible.